Early signs of prostate issues. You should never ignore. Welcome back to Youthful Aging, your trusted source for reliable health information. In today's video, we're diving into a topic that is incredibly important for men, especially as they approach or pass the age of 40. The early warning signs of prostate problems. Your prostate may be small, about the size of a walnut, but when it starts acting up, the consequences can be significant. Knowing what to look for can help you detect issues early and avoid more serious complications. So, let's get into the early signs of prostate issues you should never ignore and what to do about them. What is the prostate? The prostate is a small gland located just below the bladder in men. It surrounds the urethra, the tube that carries urine from the bladder out of the body. The prostate's main job is to produce seminal fluid, which nourishes and transports sperm. As men age, the prostate tends to grow. Sometimes this is harmless, but in other cases, it may signal a problem. The most common prostate-related conditions include benign prostatic hyperplasia, BPH, and enlarged prostate prostatitis, inflammation or infection of the prostate cancer. Now let's break down the warning signs you should never ignore. Early signs of prostate issues. 1. Frequent urination, especially at night. Waking up multiple times at night to urinate is a classic early symptom of an enlarged prostate. This condition, known as nocturia, occurs because the growing prostate presses against the bladder. 2. Weak or interrupted urine flow. You may notice that your urine stream has become weak, or it stops and starts. This happens because the prostate is putting pressure on the urethra. 3. Difficulty starting urination. You might feel the urge to go, but it takes a long time to actually start. This is another result of urethral compression. 4. Feeling that the bladder isn't empty. After urinating, do you feel like you still have to go? That's a common sign the prostate is affecting your bladder's ability to fully empty. 5. Pain or burning. During urination, this could be a sign of prostatitis or infection in the urinary tract. It requires immediate medical attention. 6. Blood in urine or semen. Any visible blood is a red flag and should never be ignored. It could be due to infection, inflammation, or even cancer. 7. Pain in lower back, hips, or pelvic area. Persistent discomfort in these areas may indicate more advanced prostate problems, including cancer that has spread. 8. Erectile dysfunction or painful ejaculation. Prostate issues can directly affect sexual function, including difficulty achieving or maintaining an erection. Pain during ejaculation is also a warning sign. When to see a doctor. If you experience any of these symptoms for more than a few days, consult a healthcare professional. While some symptoms may be minor or temporary, others may indicate serious health issues. A urologist will perform a physical exam and possibly a digital rectal exam, DRE, and a PSA, prostate-specific antigen, blood test to check for signs of prostate enlargement or cancer. Diagnosis and testing. Common tests used to diagnose prostate issues include PSA blood test, measures levels of prostate-specific antigen, DRE, digital rectal exam, a manual exam to feel for abnormalities, urinalysis, to check for signs of infection, ultrasound or MRI, imaging for more detailed analysis. Prostate biopsy. If cancer is suspected, a small tissue sample may be taken. These tests help doctors determine whether you have BPH, prostatitis, or prostate cancer. Treatment options. Treatment depends on the diagnosis and severity. Let's go over the main options. 1. For BPH, benign prostatic hyperplasia. Medications like alpha blockers to relax prostate muscles, e.g. tamsulosin, 5-alpha reductase inhibitors to shrink the prostate, minimally invasive procedures like urolift or resume surgery, TURP, in severe cases. 2. For prostatitis, infection, inflammation, antibiotics. If bacterial anti-inflammatories and warm baths for symptom relief. Chronic cases may require long-term treatment. 3. For prostate cancer, active surveillance for slow-growing cases. surgery, prostatectomy, radiation therapy, or hormone therapy. Newer treatments like proton therapy or immunotherapy may be considered depending on stage and age. Early detection often leads to more successful outcomes. Prevention and lifestyle. Here are some practical tips to help reduce your risk of prostate problems. Eat a prostate-friendly diet, rich in tomatoes, broccoli, fish, nuts. Stay physically active. Aim for at least 30 minutes of exercise a day. Avoid smoking and limit alcohol. Maintain a healthy weight. Manage stress. Chronic stress impacts hormones and immunity. Stay hydrated but reduce fluids before bedtime if nocturia is an issue. Regular checkups, especially after age 40, or if there's a family history. Prevention isn't always guaranteed, but these habits can significantly lower your risk. Prostate health is something that all men should take seriously. Ignoring early signs can lead to bigger issues down the road. If you're experiencing any of the symptoms we covered today, don't wait. Talk to your doctor. If you found this video helpful, please give it a thumbs up, subscribe for more health content, and hit the bell so you don't miss our upcoming videos. Share this with a friend or loved one who might benefit from this important information. Stay informed, stay healthy, and we'll see you in the next video.